Welcome to this presentation, which is part one of our series, where we're going to be teaching about injury risks in running, the risks that are associated with running-related injuries. My name is Dr. Gunene. I'm a sports physiotherapist and a running coach. I also run myself. So I'm excited to be talking to the runners, both the recreational runners and the elite runners. Also be talking to clinicians who are interested, those who look after runners. We all know that running is a good thing. It helps us improve our health, both physically and mentally, and many other ways. There are many benefits of exercise, of running, because it's a form of exercise, form of physical activity. So there are a lot of benefits in that. But there are risks that come with running. There are risks that whether you are doing it as a recreational thing or you are doing it as an elite for performance, there are risks that come with running. That's what we're going to be talking about, helping each other to know how to lower the risk of injuries, because it's about doing things right so that we can reduce the risk of injuries and enjoy our running. Let's go for it. First, it's our first episode, so we're gonna start by defining what a running related injury is so that we have a bit of context. We're talking about running related injury. We are referring to a musculoskeletal pain that is caused by running, whether training or competition, that results in a restriction or stoppage of running for at least 7 days or 3 consecutive scheduled training sessions. Or it is pain that necessitates you consulting with a physician or other health professionals. That's what we refer to when you say somebody sustained a running related injury. Why do we get injured as runners? Or why do sports people get injured? Literature does show that a sudden increase in load, especially that goes beyond the capacity of a person. So if your load is higher than your capacity, your chances of injuries are high. And where we want to be as athletes is where capacity is higher than the load of running, meaning that we must work on capacitating our bodies first to the point where the load is not higher than the capacity. If you do that, then your risk of injuries are reduced. This slide is just showing you a number of factors that contributes to running related injuries. As I've indicated, running load, anything related to training, whether sudden increase in volume of training, meaning the mileage that you accumulate every week, can be a factor. It is classified under training errors, or sudden increase in speed of running, or that's intensity of running, that can put you at risk of injuries. There are many other factors under this category of training errors that needs to be considered. And this is what this first presentation is about, to look into how do we manage our running load correctly. Other factors we'll look at in the next few presentations would be your biomechanical factors, skeletal malalignments, excessive weight as a factor, footwear issues, previous injuries, because if injuries are not rehabilitated, they put you at higher risk of other injuries or same type of injuries. Environmental factors, there are more factors, age and many other factors. So with risk, we are looking at internal factors, which are factors within the body, and external factors, which are outside the body. We call them extrinsic factors. But for now, let's focus on how to manage your your running load. That how do you correct training errors? Maybe before we move further, we want to look at this slide is just simply showing you what are the most common musculoskeletal injuries in running or among runners? You see a lot of patellofemoral pain, which is number one, which is runner's knee. That's a common term for it, which contributes about 16.7 of musculoskeletal injuries. We have shin splints, which we call medial tibial stress syndrome, plantar fasciitis, iliotibial bend syndrome, Achilles tendinopathy, ankle sprains. These are the 5 common running related injuries that we see among runners. Let's come back to our main point, how to manage your running load. Remember, we said running load is the number one factor. Even literature does show that it's the number one factor. A sudden increase in running load is a factor to contribute to injuries. Now the question, how do you manage your running load? I'm going to share some strategies that I hope will help you manage your running loads correctly. These are the 3 strategies that I want to talk about. First one is you must manage your acute chronic load ratio correctly. I'm going to explain and unpack these strategies. The second one is managing the rate of load increase, your weekly increment. How do you manage that? It's important. Number 3, adjust training based on your responses to external load. So these are the 3 strategies I want to share. There may be more, but I want to share just these strategies that can help you manage your load correctly and reduce the risk of injuries. Let's start with the first one, which we say is the managing of acute chronic load ratio. What is this? What is this acute chronic load ratio? Maybe let me first help you define what is acute load and what is chronic load. When we're talking of acute load, we are referring to recent training in terms of kilometers that you've accumulated in the last 7 days, meaning the recent week of training. We call that acute load. Chronic load, we are referring to long-term training, which is base training of 4 to 6 weeks, meaning that an average of the mileage or kilometers accumulated in the first or in the last 4 to 6 weeks. That's chronic load. So now, once you know what acute load is, what chronic load is, then you are at the stage where you can calculate this acute chronic load ratio, which is calculated in this way. You have to use a formula that says where you divide the acute load by the chronic load to get the ratio. Because until you get a ratio, you will not be able to know how your load is going. So you have to know your ratio. I'll give you some example just now how that is calculated. So divide acute load by chronic load. So literature does guide us in terms of what is the acceptable ratio, and the diagram that you see on the right hand side, it does show you where the sweet spot is, what is the appropriate ratio, and what is the danger zone, meaning the ratio where it shows that your risk of injuries are high. Sweet spot, injury risk are low. So you want to be in the sweet spot as you train, not in the danger zone, because if you're in a danger zone, your risk of injuries are high. Sweet spot means your risk of injuries are low. It doesn't mean that if the risks are low, meaning that you won't get injured. It means that your risks are just low. Same thing with the other side. If you're in danger zone, doesn't mean you'll get injuries. It means that your risks are high. I hope you are following. Let's look at some two examples of somebody's workload. Let's analyze this 5-week training program that has been completed by a runner. First week, this runner did 35 kilometers. Second week, 40 kilometers. Third week, 60 kilometers. Fourth week, 120. And fifth week, 100. You can see this person means business. Now let's calculate his acute chronic load ratio. We said acute load is your recent week, which is week 5. In this case, is 100 kilometers. And then chronic load is the average of the first 4 weeks, which in this case is 363.75. I've calculated this already. So to calculate, once you have the numbers for acute load and the numbers for chronic load, then you use the formula acute load divided by chronic load. That gives you around 1.6. As you can see that this is now above 1.3, which we said 0.8 to 1.3. You can take it up to 1.5. That is a sweet spot, sweet zone, meaning that the risk of injuries are low in that ratio. But if you start to move higher than that, then you are increasing your risk of chances of injuries. So this person is 1.6, which is starting to get into danger zone. We will unpack this to show you what is wrong that this person is doing. Example 2, somebody who has trained 35 kilometers in week 1, 38.5 in week 2, 42.35 in week 3, week 4, 46.6, week 5, 51.3. And his acute chronic load ratio is 1.3, which is in the sweet spot, sweet zone, according to the acceptable load ratio. So the question is, who is doing right things here? This seems to be in the right direction, but what is it that is doing that the other person is not doing? If you carefully look at the weekly increment, how these people progress every week, you realize that this second one, example 2, his weekly increment is about 10% or not more than 10%. But the other one, you find that he jumps too high every week, and that's what puts him at risk of injuries. So this is saying you must start small and gradually increase your mileage and not jump too high every week in terms of increasing your mileage. So that's what makes the example 2 a good program compared to the first one. So if you have high chronic load and low acute load, then you are safe, meaning that you have gradually built up your training. But if you suddenly increase your load, then you are always having an acute load that is high. Your risk of injuries are always going to be high. But remember, the recent literature now is advising us to say this is not just a definite or definitive threshold. It is a guide. Let's use it as a guide because individual differences and moderating factors influence how athletes respond to workload spikes. So, meaning that factors like fitness, age, injury history are considered. It is not all about ratios, and load does not explain all injuries. There are some athletes that find themselves in danger zone, high acute chronic load ratio, but because maybe they are fit enough to cope with the load, then they are not sustaining injuries. But for someone who's a beginner, you want to play it safe and make sure that you are always around the sweet spot. Your ratio is always around the sweet spot by ensuring that you gradually build up, not do sudden increase of mileage. So we've just explained one strategy to manage your workload, which is managing your acute chronic load ratio. The second strategy that you can use to manage your load is to monitor your rate of load increment. I might have touched on it already. Monitoring the rate of load increment, meaning that you must try and limit your week-to-week training load increment to around 10%, not exceeding 10%. This is a good rule of thumb, but I know there are some people who are challenging this rule. Yes, I want to emphasize this is a guide, not a strict rule. Just especially for new amateur runners, recreational, those who are starting to run, they must just be careful on making sure that you limit your week to week increment by not more than 10%. In that way, you'll be safe. Some athletes can tolerate more, especially those with high chronic loads who have been there training for longer, then they can risk it because their bodies are capacitated enough. So this is the second strategy that I'm recommending. The last one, there may be more, but for now, I'm just going to limit to 3 strategies. Adjusting training based on your responses to external load. It is important, as much as you follow a certain program, you must listen to your body. Adjust your training based on how you respond to training or to external loads. That includes training, volume of training, and all of that. So listen to your body, adjust your programs accordingly. Make sure that you avoid running with an injury because you will make that injury worse or you are at risk of many other injuries. Ensure that you recover well. So if you have not recovered, take some time, adjust your programs, and rest. Incorporate rest in your program. Treat those injuries before you come back to running. Make sure that you are fully rehabilitated. So there are many things to consider here. But the factor, the strategy is adjust training based on your response to. There are many ways we monitor how we respond to training. Today we've got smart watches that can show us our tiredness, our need for recovery, and all of that. So just see how you are coping and adjust your program accordingly. Don't do too much too soon. Don't push to do things when your body is not responding the right way. So in summary, there are 3 strategies to managing your load. First one is to manage your acute chronic load ratio, which we've explained already. And secondly is to ensure that your week to week load increment or mileage increment is within the safe zone, which is about 10% or so, especially those who are new in running. And the last one is adjust your training based on how you respond to injuries. This would be my last slide, just to highlight, emphasize on the key components of an ideal training plan. Because we are talking about training errors here. We want to know what are the components of ideal training plan. First, have a clear program, or meaning have a clear goal and timelines. Don't just do because people are doing. Do because you have a goal, and the goal must be achievable and it must be realistic. And then set your timeline so that you have enough time, you know what you do at what point. That's number 1. Number 2, structure your training very well. Don't do one thing every day. Vary your training sessions. Distance runners have more of easy runs around zone 1, zone 2 of training. That should contribute about 60 to 70% of your mileage for that week. Have your long runs, can have 1 or 2 long runs a week. Most people do weekends long runs because there's more time to run. Incorporate your speed session, your intervals, your time trials and all of that. Have 1 or 2 sessions a week of that. Have recovery runs, especially after hectic sessions. Have recovery runs. And schedule your rest days as well. 1 or 2 days a week of rest so that you allow your body to recover. Fitness happens because we recover. If you don't recover, you rob yourself of chances of improving your fitness level. So training structure is important. Another important thing is your program must follow appropriate and clear periodization or phases of training. That's why I say have a goal, have timelines, and you structure your program according to clear periodization phases. Where usually if you follow a good program, your first few weeks, 3 or 4 weeks, are called the base phase, where you're just doing easy runs without stressing about your mileage. You're just getting your body used to running, right? And then number two, phase two will be more working on strength. Remember, we're capacitating our bodies now to cope with what is coming. So you do your strength training. Not that you only do that in that phase. You run, follow the structure of running, but focus more on strengthening your heel repeats, your resistant exercises in that phase. Then you move to another phase, which is called speed or sharpening phase, where you're now working on your high intensity work to improve the capacity of running fast. You improve your VO2 max capacity and all of that. Then we have another phase of tapering, meaning that you are getting closer to race period. Then you do taper to just let the body recover, reduce your mileage to ensure that your acute load is not always high. Then race week, obviously, you prioritize the race. And then you start again the cycle with a new goal. So make sure that you have clear periodization. Another important thing, incorporate cross training. Just give your body a chance to do certain other things that are not running as a way to keep fit, but reducing the load of running a bit. You can do your cycling, your swimming, and other things. And then look into doing strength work. We've emphasized on the importance of strengthening of muscles, do resistant exercises. Progression, we talked about how important it is to progress correctly every week. Nutrition is important for recovery, for fueling as you do the activities. So nutrition before, during, and after is important. Sleep is important, recover well. And then adaptation, we talked about ensuring that you adapt correctly according to how your body responds to training. Thank you so much for listening. I hope you found this interesting, and we look forward to the next episode where we're going to look at another factor that contributes to injuries and how to lower the risk of injuries. Thank you.